So this patient, Shan, his father got in touch with me about 3 months back. The patient had been known to be a case of congenital heart disease from the age of 2 years.
ကျွန်တော်နာမည်ကတန့်စင်ထောင်းဖြစ်ပါတယ်ကျွန်တော်သားနာမည်ကထူးထက်ရှန်ဖြစ်ပါတယ်ကျွန်တော်သားကိုဒီစေကူကိုဒီကိုလာပါတယ်မြန်မာပြည်ကနေပြီးတော့စေကူကိုအပေါ်လိုသိအောင်လာပါတယ်
He had a small VSD, and as a result of that VSD, he had now developed infection on the valve which is next to the VSD, the hole in the heart. So he had infection on the valve, he was running fever, he was very sick.
နှစ်နဲ့၄လပေါ့နှစ်၄လတည်းကစတည်တာပါနှလုံးရောဂါကိုစတည်ပြီးတော့မြန်မာပြည်ကပါရမီစိတ်ရုံဓာတ်ဒေါက်တာခမောင်ဦးနဲ့ပြပါတယ်ဆရာကြီးဒေါက်တာခမောင်ဦးကနေလမ်းညွှန်မှုနဲ့အိန္ဒိယအဘောလိုကဆရာကြီးဒေါက်တာGaurav Kumarရှိကိုဘာရောက်ကုသခြင်းဖြစ်ပါတယ်
So I advised him to undergo the primary treatment there in Myanmar, have antibiotics for 4 weeks to 6 weeks, and when he settles down, then he can come to us. After he settled down, they contacted us again, and then I had a look at all the reports and blood cultures and blood tests, and he was fit for surgery. So he came to us about 3 weeks back. We assessed the patient, we found that his tricuspid valve, the valve on the right side, is totally destroyed by the infection. We took him up for surgery and we gave him an artificial valve. We replaced the valve with an artificial valve. He recovered very well. He has done very well and he continued to do well. Now the infection in his heart is completely gone. He's got a new valve.
ဆက်သိပြီးတဲ့နောက်မှာရှားခြင်းနာခြင်းရှိပါဘူးနောက်အစားအသောက်တွေကလည်းပုံမှန်စားပါတယ်ပုံမှန်စားကောင်းမှုတွေအရင်လည်းပြောပါတယ်
We'll keep him on follow-up for every 3 to 6 months and keep on monitoring him. I'm really happy that the patient has done well. These are difficult patients because any residual infection in the heart can be devastating for the patient.
ဆရာကြီးဒေါက်တာGaurav Kumarနဲ့တွေ့ရတာအရင်လည်းပုံပြပါတယ်အရင်လည်းဝမ်းသာပါတယ်